This conference will now be recorded.
Hi everyone, my name is Kathy Barnard and I'm the founder of the SYSF Foundation. I would like to thank Ivis and Steve for giving me the opportunity to present our joint COVID-19 patient survey. During the month of March, Save Your Skin was flooded with calls from patients, caregivers, and the medical community about the needs that had arisen due to the pandemic. Since most of the information to date had been anecdotal, Save Your Skin took a proactive approach to attain more information from the melanoma community through survey development and implementation. So from April the 9th to April the 27th, Save Your Skin Foundation ran a patient survey titled Impact of COVID-19 Pandemic on Canadian Melanoma, Ocular Melanoma, and Non-Melanoma Skin Cancer Patients. The survey consisted of 21 questions, which ranged between multiple choice, multi-selection, and write-in, and participants had the option to skip any question. The goal of the survey was to assess the impact that COVID-19 pandemic had on medical, social, and financial security of our patients. We first wanted to gauge by asking our patients what type of cancer do you or did you previously have? We had 84% of the participants were currently living with melanoma, ocular melanoma, and non-melanoma skin cancer. So as you can see, we had a real good cross-section of all the melanoma and non-melanoma patients. We had 8 out of 10 provinces represented, which was a pretty good base for us here in Canada. We wanted the patients to best describe their stage of care. So were they newly diagnosed? Were they waiting for treatment? Were they waiting for surgery? We even had some patients that were no evidence of disease. We actually had 11% of the patients that participated outside of the melanoma space. So we had breast, ovarian, and colorectal cancer also participate in the survey. Right in those beginning days, 38% of the participants stated that they were already having difficulty accessing medical follow-up. We asked the patients to what degree the COVID had created difficulties connecting to any type of healthcare. So was it their general physician, their clinician, the nurse, the pharmacist, oncologist? As you can see, 31% of participants had experienced some difficulty connecting with their healthcare providers. To what degree has the continuity of oncology care been affected or will be by the COVID-19 pandemic? Some said not at all. Some was just some. And a lot were actually anticipating the disruption in their care. And that was quite telling to us because we were actually already hearing that from the physicians as well. 20% of participants were anticipating that there would be disruptions. 52% of participants stated that they found their distance appointments to be suitable substitutions for their regular appointments. Now, I will let you know that 52% of those patients were melanoma patients that were already in the system. So that's why we feel that they were probably finding it suitable. For our patients in the non-melanoma space, they had a few concerns because they were worried that most of them didn't have the technology, so that when they were talking to their GP or dermatologist, they were not able to see their skin. And that was a huge concern for a lot of the patients. 20% of participants stated that they were having difficulty receiving their scheduled care. So we were finding that, as most of you will know, clinical trials were canceled. Those that were waiting for surgeries were delayed. Referrals were delayed. So we were actually starting to see a real uptake in the anxiety level of our patients. 37% of our participants still say they had a lot of confidence in their healthcare system. So that was, and their healthcare team. So that was good for us to know. But they did note that they were having concerns with other things. Mental health was huge. 53% of the participants said that their anxiety had increased somewhat. But we were hearing from a lot of patients that the isolation and the fear of not getting into the system was actually really exhilarating the mental health and the anxiety that they were already feeling after that cancer diagnosis. 50% of the participants expressed fear that they were now more at risk of COVID due to being immunocompromised. 45% of participants stated that they were already experiencing that difficulty accessing information related to the COVID-19. 46% of participants were having difficulty accessing food and food deliveries because, as in most countries, people in Canada were told to stay home if they could and get most of either their medications or their food delivered if possible. 15% of the participants were having difficulty getting transportation to their treatments and their clinical trials. 64% of participants said they were having some difficulties keeping in touch with their community. And as cancer patients, we all know how important our communities are to us in dealing with this disease. There were another number of impacts. You can see that we asked a lot of patients, what their big issues were. The biggest concern for some were to be for our patients that had been free of disease, where they were concerned about what would happen if their cancer came back, how would things unfold for them. Again, there wasn't enough knowledge on how COVID-19 was going to impact immunotherapy patients. So there was a really spectrum of concern throughout our patients, really around how COVID was going to affect them throughout the process. The conclusion that we came to at Save Your Skin was that the results of these surveys suggested that cancer patients across Canada were experiencing the same COVID-19 related social and financial anxiety as with other cancer patients in Canada. We started having discussions with a number of patient organizations throughout Canada on what they were hearing from their patients, and we were finding that there was a very similar track. However, our cancer patients were also had that added stress in Canada of navigating an already very complex medical system in this time, having treatments rescheduled, appointments online, and being at higher risk was really adding to their mental wellness. So that at this time, we were finding that it was really imperative that we keep in mind the segments of our population who were having particular difficulty at the time. So patients that didn't have a great support network, that were living in a more rural area, were being treated in a smaller center. So COVID-19 also posed an incredible challenge to the cancer community in the US. During that same time, the MRF had also been flooded with calls from patients, caregivers, and the research community about the needs that had arisen due to the pandemic. So with permission from Save Your Skin, minor edits were made to our survey to make it more US specific and melanoma specific. Additional answers and choices were also incorporated for those diagnosed with rare melanoma subtypes before being distributed to the MRA patients. This partnership really provided both of our organizations the ability to compare the impact of COVID-19 between the two countries. And even though our healthcare systems are quite different, the needs of our patients were very similar. And I'm sure that you would be able to say the same of your patients in your countries. So from June the 4th to the 17th, MRF implemented the impact of COVID-19 pandemic on the US melanoma patients. Their survey comprised of 24 questions, receiving 171 responses, with 148 identifying as melanoma patients. Their responses were received from 39 states. While MRF was pleased with the number of responses, a larger sample size may have allowed for a broader generalizations and interpretations. Likewise, melanoma knows no geographic boundaries, and thus, ideally, all states being represented would have been great. So again, what type of cancer do you or did you previously have? You can see they wish they had had more of the bigger representation. We had the cutaneous melanoma, ocular melanoma. There was a few pediatric and acral melanoma, but it's still a pretty good cross-section. Have you had any disruptions, cancellations, or postponements to the following situations? And check all that applied. Approximately 85% of respondents reported some amount of disruption in treatment and care follow-up appointments. Some actually had responses. Specialist appointments scheduled were a year out. The appointment was then canceled due to COVID and had to be rescheduled. Approximately 70% of respondents responded a lot or some difficulty connecting one or to multiple healthcare providers. 43% of responses reported had no issues at all with the continuity of oncology care during the pandemic. 73 reported being offered telephone or video teleconferencing, and just over 41% have respondents stated that they found virtual appointments to be a suitable substitution for their regular appointments. 25% of respondents felt that virtual appointments were not an appropriate situation. We asked questions, is this pandemic causing you more anxiety than usual or aggravating your existing mental health issues? More than 80% of respondents reported that the pandemic is causing more anxiety than usual. A lot of patients were now having to go alone to appointments, which was increasing anxiety. As one patient says, it was very hard not to have visits from family and friends when you know you have a terminal illness. And when can I want to be careful, but I need to see my children and grandchildren. More than 50% of respondents are experiencing anxiety, fear, stress, or feel overwhelmed for themselves and others. We were hearing that across the board. Respondents report that their quality of life has been affected in the following ways. 50% were experiencing difficulty staying connected to family and friends. 35% were experiencing difficulty attending appointments or seeking necessary health care because of fear of exposure to COVID-19. And 6% were experiencing difficulty accessing COVID-19 related information. As you can see, everything has changed. The full life slate wiped clean. The volunteering I used to do, meetings I attended, hobbies are all a thing of the past and for the young and fit. Working from home and teaching and being a single parent to a toddler, no local family support system. To what degree has your medical coverage been affected by COVID-19? 80% of respondents reported that there was no medical coverage issues due to COVID-19. That was quite a bit different than we saw in Canada. To what degree have you experienced difficulties accessing food and/or food deliveries? A third of respondents reported having some difficulties accessing food, but a lot of respondents said not at all. I'd like to just show you a little comparison between the US and Canada, some of our similarities and differences. 43% of respondents reported having no issue with the continuity of oncology care during the COVID-19 pandemic. This was up from 34% of our Canadian respondents. As you can see in the US versus Canada, there were more reported issues in Canada than in the US. 67%, or 2/3 of respondents in Canada, reported having or being offered telephone or video conferencing appointments, while a healthcare professional since February of 2020 compared with 73% of US patients. 52% of the Canadian respondents stated they found these types of appointments to be suitable substitutions for the regular appointments, but only 41% of US patients found these to be suitable substitutions. 45% of respondents in Canada reported difficulties accessing information on COVID-19, as compared with only 6% in the US. 75% of respondents and 80% of Canadian respondents reported a lot or some difficulty keeping in touch with friends and family during the COVID-19 pandemic. So the conclusions were experts worldwide agreed that COVID-19 pandemic had created a global health crisis. Some consider this pandemic to be far more than a health crisis, but a human, economic, and social crisis as well. These vast negative impacts have affected nearly all segments of the population, but have been particularly detrimental to those already vulnerable situations. The result of the COVID impact pandemic on US Melanoma Patient Survey indicates that the melanoma community has experienced similar impacts of the general public, but they have also faced a variety of additional challenges. Overall, Canadian and US melanoma patients reported very similar experiences as it pertains to melanoma treatment, care, and social interactions during the COVID-19 pandemic. The most glaring differences to be in the availability and ease of finding COVID-specific health information. 45% of respondents in Canada reported difficulties accessing information, as compared with only 6% in the US. The MRF and Save Skin Foundation plan to implement the survey again in February of 2021. And at that time, we will be able to show you our comparisons and findings, and will be explored, and a report will be generated. To date, the MRF has developed 2 additional resources to educate and support the melanoma community during COVID-19. The COVID-19 and melanoma website was developed in March 2020 as a hub for all melanoma and cancer-related resources information. The MRF has listed resources development by a variety of reputable government agencies, patient advocacy organizations, and professional organizations. These resources are available for both the patient community and the healthcare provider community. Webinars and COVID-19 facts are also available. In order to provide Canadians living with melanoma, non-melanoma skin cancers, and ocular melanoma with the most up-to-date information and resources related to COVID-19, we have partnered in Canada with a group of other Canadian patient organizations to create the COVID-19 Patient Support Hub. It's an initiative that is under the All Can Canada umbrella, which was founded by Save Your Skin Foundation. We will be continuing with this patient hub in 2021. As you can see, we have mental health and wellness, facts and resources, and practical support. We have also done webinars related to COVID-19, not only for our patients, but also for our physician community. Thank you very much for taking the time to listen to me today and for participating in the global meeting. If you have any questions or feedback, please email myself at Kathy@SaveYourSkin. And again, thank you and have a great day.